am Dr. Yogalakshmi, hematologist in Kaizen Hematology Oncology network. Today we will discuss whether bleeding from nostrils is significant medically. Many patients come, especially children, that they are having some spots of blood, some bleeding from either of the nose, either right side nostril or left side nostril. Maybe once in a while frequent bleeders are also there. So first of all, if we look at the bleeding from the nose, we have to see is there bleeding from any other sides also. If at all the patient is having a bleeding from some other sides like skin, where you have red spots in the legs, in the hands, or there is a bruises, easy bruising anywhere in the body, then it is medically significant. So the bleeding from the nose also can be a part of some blood disorders, either low platelet counts, or there can be some disorders in the clotting mechanism. Whereas some children bleed mainly particularly in the winter season, or when the nose becomes dry, or when the patient has an upper respiratory tract infection. So in those cases, and there is no bleeding elsewhere in the body, then there will be usually no identifiable causes, no treatable causes for bleeding from the nose. Initially, if the bleeding is stopping after pressing the nose, then usually in 5 to 10 minutes if it stops, then usually there will be no problem regarding the blood parameters or the platelet counts or any coagulation defects in the blood. Initially, if there is a bleeding, they can always consult a ENT specialist, but before consulting ENT specialist, if usually when there is a bleed, we should not wash it torrentially with the water. Just pinch the nose and put down the head a little, and the child can be made to sit. After that, if the bleeding doesn't stop after 5 to 10 minutes also, then they should visit a doctor, ENT doctor, to consult and to clean those areas, and if at all requiring any packs for the nose, they can get it applied. If at all the bleeding is severe and the bleeding requires blood products, like there is too much of loss of blood, that BP is coming down, too much of blood loss, that the patient requires some plasma or platelet transfusions to stop that bleeding. There can be a blood problem, mainly problems in the platelets or coagulation defects. So those children will require further evaluation, what the problem is, and the treatment according to the problem which is coming. If there is a family history of bleeding from any other site, then it is required to consult a doctor to know what kind of problem is in the blood which causes the bleeding. If at all only minor bleeds, no other bleeding from any other site, then there is no point in evaluating further. Thank you.